Hi, my name is Sarah Quigley, and I'm one of the outpatient lactation consultants at UCSF. And I'm here today to talk with you about what you need to know in the third trimester of your pregnancy about breastfeeding and getting off to a good start. So, one of the things that we really like to emphasize to encourage breastfeeding is frequent skin to skin contact as soon as possible after birth. And if you give birth vaginally, so provided there's no other reason to separate you from your baby right after the birth, baby's going to be placed on your chest, skin to skin, and your baby will be able to spend about the first hour there after birth with you. We call this the golden hour. And this is a really wonderful opportunity to just enjoy your baby, feel the softness of their skin, and count their fingers and toes, and also breastfeed them for the first time. And you're going to get plenty of help with that. All of our nurses at UCSF are trained in breastfeeding, so they can help you position the baby, see if the baby's latching, and just help to make that comfortable for you. Now, if you have a cesarean birth, of course, it's going to be a little bit different, but we do also get babies and their parents skin to skin as much as possible in the operating room. So after the baby is born, we brought over to you as soon as possible. And as the birthing parent, you can hold your baby skin to skin on your chest or cheek to cheek. And also we encourage support people and partners to hold the baby skin to skin as well if the birthing parent's not able to do that. And then you can have your first breastfeeding session shortly after you're out of the operating room. So why are we emphasizing skin to skin, and why do we think it's so important? Well, we know that holding babies skin to skin helps to regulate all of their body systems. So they stay warmer, and this helps to regulate their breathing and their heartbeat and their metabolism. And also babies held this way are calmer. So makes it a lot easier to take care of your baby and also to breastfeed your baby. Calm babies usually go to the breast more easily. And holding your baby skin to skin is going to encourage them to breastfeed and latch. This really stimulates all of their great feeding instincts that they're born with. And it's what I like to call keeping the baby in the kitchen. So the more you can hold your baby skin to skin in these early days and weeks, the better it is going to be for breastfeeding. And it's just such a wonderful bonding opportunity for either parent. It's a really lovely experience. So I encourage you to try it. So we also encourage parents at UCSF to keep their babies in the same room with them during their hospital stay. And there are a lot of good reasons for this. First and foremost, this is really the way that you're going to most quickly learn who your baby is and how to best take care of them, right? You'll be right there watching them, listening, being able to respond. So in particular, this is a great way to get breastfeeding off to a good start. As soon as your baby's hungry, you're right there to breastfeed. And it also makes it easier to breastfeed frequently. We know that the more frequently you can breastfeed, especially in the early days, the better that is for establishing your milk production and just generally learning how to breastfeed, because breastfeeding is absolutely a skill that parent and baby learn together. And so they need plenty of practice to do that. And a lot of parents find that they also just become confident more quickly when they have the baby in the room with them at the hospital. They learn how to change those diapers and burp and use different calming techniques. And this is something that the nurses are also going to be on hand to help you with. So any questions that you have about baby care, they can assist you. And the newborn nursery is available at UCSF, but you're going to definitely be encouraged to keep your baby in your room with you as much as possible. And a lot of parents tell me they actually felt calmer having their baby near them. Sometimes when the baby went away, they felt a little more stressed. So you may find that you really want to have the baby there with you as well. So a lot of new parents will ask me, should I feed my baby more milk other than what my baby takes at the breast? So should I be giving my baby pumped milk or formula? How does that work? So This is something that you don't have to figure out on your own. So if there is a reason for your baby to have more milk than what he or she is taking from breastfeeding, you're going to get guidance about that from hospital staff. So we have the pediatricians who are going to be assessing that, and the lactation consultants. And then once you leave the hospital, you'll continue working with pediatricians and lactation consultants if your baby does need extra milk. In some cases where that might be medically necessary, if, for example, your baby was having any difficulty breastfeeding in the early days, or if your milk was not increasing as quickly as expected, there may be talk about giving what we call a supplement, and that could be first choice, your own pumped milk if possible. We also offer donor breast milk at the hospital, and formula is available as well. But that's something you're going to get guidance on. And we really do encourage you to avoid any type of supplement unless it's medically indicated. So the pediatrician, the lactation consultant are telling you that your baby's getting enough milk from breastfeeding, then you'll know that that's all he or she needs. Sometimes if formula, for example, is introduced early on, it can actually interfere with the establishment of milk production. It could possibly decrease milk supply. Babies tend to spend less time at the breast if they've had a bottle of formula. So yeah, we just recommend feeding at the breast as much as possible. And also, feeding your baby something other than your own milk does carry some health risks with it, an increased risk of allergies and asthma, obesity, diabetes. So certainly everyone agrees you want to keep your baby well fed, and sometimes extra milk might be part of that plan. Want to, give your baby as much of your own milk as possible. So those are a few things that are good to know as you're going into your third trimester of pregnancy. And also just want to let you know that after your baby is born, you can get lots of support from UCSF. So we have, of course, our wonderful lactation consultants in the hospital who are going to help you. And then also after you leave the hospital, you can make an appointment to see me or one of the other lactation consultants in the outpatient clinic. And we offer both video and in-person appointments. And our appointments are generous in time. They're 75 minutes long, so that gives us lots of time to answer your questions, watch your baby breastfeed, help you learn how to use your breast pump if that's something you need, and also to create a short-term plan. We also can follow up with you and have more appointments after that first one if you continue to need support. And if you're between lactation appointments or just want to learn more about breastfeeding, we also have our milk breastfeeding support group, and this group meets twice a week over Zoom, and it's free. It's open to anybody who's interested after they give birth. It's for new mothers and their babies, and it's always facilitated by a lactation consultant. I do facilitate one of the groups, and it's a very welcoming community of new parents, and so that's another great place to ask questions, get tips, hear what other people are doing, and just get lots of support so that you can meet your breastfeeding goals.